Let's talk a little bit about some of the parameters that you'll be following and measuring with your medical provider during the weight loss phase of the program, or the rapid fat burning program, and after also. So the first thing that we're going to be checking is your body fat percent. And the body fat percent will be measured by impedance, which is electric current flow between your hands and your feet, and your feet and your hands, and hand to hand and foot to foot, so multiple directions. What this gives us is a nice body fat percentage, which tells where you carry your fat, and also how much fat you have on you as a percentage of your total body weight. Because it's very important to know this, not all people who are overweight on a BMI or body mass index or on those curves that insurance companies use are truly overweight. If someone has lots of muscle mass, then they can be much heavier and still be an excellent weight and still be very fit and in good shape, compared to someone who has a low muscle mass but lots of fat on them. Two people can weigh exactly the same, one person fit, other person not fit, because the not fit person has a much higher body fat percent. So we're actually going to measure this throughout the course. Your medical provider will be measuring this and tracking this with you, and you'll see that your body fat percent comes down substantially as you go through the rapid fat burning phase. So suppose you start out at, say, 38% body fat, and you're going through the course of the program. By a month you might be 36 or 35, by 2 months out you might be 32, and so on. Now what's normal? Normal for women is a body fat percent of 36% or less. And this is higher than most women would expect it to be, but 36% or less is normal. We consider 28% or less ideal. So if you can get below 28%, you're doing great. For men, it's under 23% is considered normal, and under 16% is considered ideal. The other thing that we'll be tracking is your waist to hip ratio. This will be it's actually abdomen to hip is a better way to think of it. It'll be, for women, we'll have measurements done at the high waist area, the mid-abdomen, which is near the belly button, and the hips, circumferentially. And for men, it'll just be the abdomen and the hips. Now we create a abdomen to hip ratio for each patient, which is the abdomen circumference divided by the hip circumference. And this will allow us to create what's called a IPL fat type. The IPL fat type tells us where your fat is distributed, whether it's more abdominal, meaning central fat, or if it's in your hip area. If you're a type 0, 1, or 2, you have your fat distributed to your hip area, which is actually, from the standpoint of both appearance and risk factors for disease, much better. Lower risk of diabetes, heart disease, high cholesterol, metabolic syndrome, obesity-related cancers, all of those things are much lower with fat type 0, 1, or 2. Fat type 3, 4, 5, and 6 have sequentially greater amounts of fat in the abdomen compared to the hips. And so those patients or people look a little worse and have a higher risk of disease, with 6 being the highest. So we're going to have the medical providers measure the abdomen and the hip ratio and create that ratio for you, and then that will allow them to tell you if you're a fat type 0 or IPL fat type 1, 2, 3, 4, 5, or 6. Now what you'll see during the course of the program, since this causes a lot of abdominal fat loss, is that your abdominal fat will drop dramatically, and therefore your fat type will drop. And we generally see it drop 1, 2, or even 3 fat types during the course of the program.